Diagnosing someone who is a probable candidate for bipolar disorder can easily be resolved if the person is already exhibiting symptoms. Although, if the symptoms aren't that prominent and the person is subject to coming back to his normal status, it wouldn't be likely to be diagnosed because of the apparent signs. In this video, you learn what is bipolar disorder, how to diagnose someone with bipolar disorder, the laboratory tests, physical tests, psychological exam, criteria for diagnosis, and how to rescue bipolar disorder sufferers. What is bipolar disorder? Bipolar disorder is a serious mental condition marked by means of alternating periods of elation and depression. People with bipolar disorder can have extreme moods of feeling really high, very energetic and euphoric, manic, or feeling truly low, depression. Some of the keywords include mental health, bipolar disorders, addiction, treatment, rehab, health, disorder, mental disorders, mania, manic depressive disorders, manic depression, depression, psychological disorders, healthiest mind, etc. If you are new to Healthiest Mind channel, welcome to our channel and please subscribe for more interesting videos like this. To mentally suspect someone having a bipolar disorder within the family or the community is hard, especially when you have no idea where to start. It's best to leave it to the experts. It's easier to diagnose something that is shown than something that is not. When you see someone with bleeding hands, you know that you have to fix medications and clean the wound of the affected part. When it comes to diagnosing a person with such a psychological disorder, it wouldn't be easy as telling that he has broken ears or swollen fingers. Tests must be made to diagnose if the person is really undergoing a stage of the disease. Upon testing a person, he goes into numerous psychological and medical examinations which can help assume or rule out any kind of problem. These tests can also help check if there are any related complications that have occurred to support the problem. The tests to help diagnose a problem generally consist of laboratory tests. Testing via laboratory usually includes CBC or complete blood count, other blood tests, and thyroid tests. Urinalysis may also be provided. Physical tests. This is all about the outer physique of a person that includes the measuring of weight and height, taking of vital signs such as the person's temperature, respiratory and pulse rate, and blood pressure, auscultation of the lungs and heart, and examining the abdomen as a whole. Psychological exam. Considered as one of the most important parts of the test. Here, the physician will initiate conversation and trigger some of the patient's inner thoughts and feelings. Psychological exams can help distinguish the behavioral pattern that might have caused the disorder. The patient may also be asked to fill out certain questionnaires that can help in psychological assessments. With proper permission from the patient, the doctor can also question close relatives and friends that can further provide information on episodes of depression or mania. Criteria for diagnosis. In order to be diagnosed with the disorder, a person must meet certain criteria that are stated by the manual published by the association which is responsible for American Psychiatric Society, indicated as the Diagnostic and Statistical Manual of Mental Disorders. This manual can be the basis for health providers to diagnose conditions regarding mental health. Upon diagnosing a person, the criteria must be based specifically on the type of bipolar disorder as well as the types of episodes and history. To be able to learn more about the situation, you have to talk intently to your doctor and ask the long-term treatments to the condition. Researchers say that bipolar disorder can be regarded as a series of disorders with varying symptoms and degrees. It is very important to early diagnose a person with bipolar disorder. In the event that people are misdiagnosed or undiagnosed, the person affected will not get a sufficient cure because the treatment may be severe or inappropriate. Thus, treatment will just go to waste. Now, how do you rescue someone you love suffering from bipolar disorder? Rescuing bipolar disorder sufferers. Anyone who suffers a bipolar disorder can't possibly stand alone. He needs the utmost support of his family, friends, and whoever is close to him. True, that a person needs to undergo a series of tests and treatments to be able to tend to him well. Although, it doesn't end there. After getting out of the rehab, what's next? Help is always there. One must only shout the words and seek for it to make things a bit better in his life. You can search for help in medical schools or any affiliated programs, psychiatric departments of hospitals, clinics, mental health centers. People who have bipolar disorder need attention. Without it, there will be no success in any kind of treatment. Oftentimes, people who have a bipolar disability don't realize the impairment of the disease because they think of their problem as some cause of debilitating normality in their everyday living. People usually ask help when the disorder is already striking hard. Families and friends have a big responsibility over someone who is experiencing bipolar difficulties. Therefore, it is important that great encouragement to get treatment must be imposed. If you have no idea about where to bring the family member who is affected, you can ask your family physician for referrals to where would be more appropriate to bring him. With this kind of responsibility, family members and friends must be ready to let the person with the bipolar disease to be hospitalized in order to protect him or her from further harm. Emotional as it seems, the family and friends must be able to cope with certain situations in which the person who has bipolar doesn't want to go into rehabilitation and forced hospitalization will occur. Once inside the facility, families and friends must always show total support and encouragement. In order to make the person feel that he is still important to those around him and fast recovery and treatment is possible. Although, one needs to understand that the course of treatment is not a one-day scenario. It goes a long, long way. The physician needs to know the appropriate intervention that should be given to the patient in cases of mood swings and intervals. While others have a stable mood of being in a manic stage, others show a relapse from being aggressive to being repressive. Other people who suffer from the disorder voluntarily surrender themselves in a rehabilitation facility and are oftentimes joined with support groups who can further enhance the capability of treating the disorder. Groups that are sponsored by associations like the NAMI or National Alliance for the Mentally Ill. Benefits can also be taken from these support groups by the families and friends of the patients. For families and friends, it is important that you understand the situation your loved one is going through. It is a tough battle. If you have noticed certain attitude changes due to bipolar disorder, it is better to deal with it than act as if nothing's wrong just because you are ignoring the fact of life. Having a difficult time dealing with the person's episodes can be hard. But realizing that the person is having a more difficult time experiencing the disorder and being excommunicated and ousted from frequent society is more painful. You have a lot of help outside your home. All you have to do is reach out. Thank you for watching, and if you like the video, give it thumbs up and please subscribe to Healthiest Mind channel for new videos every week. We'd love you to catch up on our latest uploads below and connect with us on social media. Facebook, Healthiest Mind for Real.